Welcome to The Critique. Today we're reviewing a comprehensive manuscript that proposes using military-grade inspection architecture and continuous improvement science to solve the billion-dollar improper payment crisis in America's healthcare system.
Right, let's just dive right in. The foundational comparison between aviation safety and healthcare reform provides a compelling conceptual anchor, but it occasionally overlooks the unique political and jurisdictional constraints inherent to Medicaid.
Yeah, it is a fascinating premise, but when you look closely at how the text transitions from that aviation analogy to actual healthcare reform, there's a pretty significant logical gap.
Exactly. The weakness here is that the aviation model relies entirely on a unified federal authority. Like, you have the FAA, and they dictate the rules of the sky, full stop.
Right.
But the healthcare system, especially Medicaid, is hindered by intense state-federal sovereignty conflicts. You have the anti-commandeering doctrine, states actively resisting federal oversight, and deep financial incentive misalignments.
And complex billing actually profits providers in a lot of ways.
Right, exactly. The logical gap is that aviation safety is politically neutral. Like, everybody agrees a plane shouldn't crash. But healthcare spending is highly politically volatile.
Oh, totally. I want to push back on the core of the aviation analogy for a second, though, specifically regarding the incentives.
Okay, yeah.
Because if we look at an airline pilot and an airline CEO, they have perfectly aligned incentives. Neither of them wants the plane to crash. Their lives, or, their livelihoods, literally depend on staying in the air.
Gravity is a universal enforcer.
Exactly. But if you look at a hospital billing coder and a federal Medicare auditor, they often have entirely opposing incentives.
Yeah, that's true.
The hospital is incentivized to maximize revenue through highly complex coding just to keep their doors open. Meanwhile, the auditor is incentivized to minimize payouts to protect the federal budget.
Right. Financial compliance is basically an artificial construct.
Exactly. So how can the material better reconcile this fundamental difference in human motivation? Because right now, the author's primary structural argument might just get dismissed by a skeptical policy reader.
That is the exact crux of the issue. The suggestion here is to adapt the aviation analogy to explicitly address healthcare's political volatility early in the text.
Okay.
They need to demonstrate exactly how the proposed solutions are uniquely engineered to survive jurisdictional battles, rather than just assuming immediate compliance.
So how do we make that actionable on the page? Do you have a concrete example?
Yeah, let's look at Framework 3, where the author proposes the Healthcare Integrity Board. Right now, it's presented somewhat similarly to the FAA.
Right.
But as a concrete example, the author should draw a direct contrast between the FAA's unilateral regulatory power and this new board. Highlight how the board must be specially insulated from political election cycles.
Oh, I see. Like through fixed-term appointments or multi-year funding?
Exactly. Prove to the reader that this board won't just evaporate the second a new administration takes office.
Because, an aviation safety protocol doesn't get repealed just because the political winds shift.
Right. And another concrete example would be to introduce the concepts from Framework V, which covers cooperative federalism with shared savings, much earlier in the manuscript.
Wait, so bring that whole framework forward?
Yeah. Don't wait to explain how you'll get the states on board. Show exactly how the system will navigate state resistance by explaining the behavioral economics of it early on.
Oh, that makes a lot of sense.
If the text immediately acknowledges that you can't rely on a visceral fear of crashing, it completely disarms the reader's skepticism. You align the hospital coder and the federal auditor not through gravity, but through mutually beneficial financial architecture.
Which proves to the reader that you understand states won't simply fall in line like airline pilots following air traffic control.
Precisely.
Okay, so assuming the author adapts that analogy and gets the skeptical reader on board early, the next big hurdle is actually keeping them engaged.
Yeah.
And right now, the manuscript's shift from identifying structural failures to proposing specific engineering fixes is logically sound, yet it creates a bottleneck that might overwhelm non-expert policy readers.
The pacing is definitely the primary weakness in those middle sections.
Oh, for sure.
The text spends 10 highly detailed chapters diagnosing the pay and chase retrospective audit problem and explaining Deming's plan, do, check, act cycle.
Which is a lot of theory to get through.
It really is, and it leaves the highly actionable engineering fixes, such as the 36-month implementation roadmap and the 4-layer AI detection frameworks, totally backloaded in the final chapters.
Right, and when we determine if the proposed implementation roadmap is clear enough for non-expert policy readers, we have to consider when they're actually encountering it in the text.
Exactly. By backloading the solutions, the pacing risks losing readers who are eager to see exactly how to implement the changes.
Because policymakers and healthcare executives are reading this to solve a burning crisis.
Right. If they have to slog through 10 chapters of historical diagnosis before seeing the blueprints, they're going to abandon the project entirely.
Yeah, if we look at that section discussing the failure of post-payment audits, the pacing feels like a doctor giving a patient a 3-hour lecture on the cellular pathology of their disease.
Oh, that's a good analogy.
Like drawing out the molecular structure of the virus on a whiteboard before finally handing them the prescription in the last 5 minutes.
Yeah, the patient already knows they're sick.
Exactly. They know they're bleeding money. They just want to know how to stop the leak.
Right. So the suggestion here is to interweave the specific engineering frameworks into the earlier diagnostic chapters. That way, the reader can immediately visualize the practical application of the theoretical concepts as they're introduced.
You don't have to wait until the end to show them the cure.
No, not at all.
So what does that look like? Can you give a concrete example of interweaving that?
Yeah. So when dissecting the failure of post-payment audits in Chapter 3, briefly introduce a specific mechanism from the AI detection layer in Framework 2.
Okay, so bring a piece of the solution right into the problem chapter.
Exactly. Show what a prospective solution looks like in real time. If you're explaining how retrospective audits take 18 months to claw back funds, immediately demonstrate how your AI model flags a massive billing anomaly before the money even leaves the system.
Oh, wow, yeah. That immediately shifts how you read it. It stops being a historical complaint and starts reading as a viable engineering manual.
Right. And another concrete example is when discussing the ACT phase of Deming's cycle. The author needs to explicitly preview the Sentinel State pilot from Framework V.
The real-world 24-month manifestation of the theory.
Exactly. Don't just leave it as an abstract concept. Demonstrate exactly how a state would safely fail or succeed in a contained environment before a national rollout.
Pulling that Sentinel State pilot forward is crucial. It grounds the continuous improvement science in a tangible geographic reality.
It really does.
And honestly, assessing if the author presents a truly unique solution compared to existing reform literature requires showing those unique solutions as soon as possible.
Right. State-level pilots are notoriously difficult to execute politically. By putting that roadmap front and center, you prove you're offering a tactical playbook, not just an academic critique.
Yeah, it embraces the messy reality of state implementations. So we've grounded the theory in tangible geographic reality, which helps the structure immensely.
For sure.
But beyond the structure, while the overall analysis maintains a rigorously professional and objective tone, the direct equivalence drawn between aviation fatalities and healthcare financial leaks risks feeling factually unbalanced.
This is a really delicate area of the manuscript. The weakness here is that equating a 1% billing error rate with a fatal commercial plane crash stretches the reader's suspension of disbelief.
Right. Because the immediate human cost of administrative financial leakage is simply less viscerally shocking than a downed aircraft.
Exactly. And because of that, it makes the comparison seem slightly hyperbolic. It could alienate the exact healthcare administrators the author is trying to persuade.
Well, yeah, because those administrators generally view billing errors as administrative drift, not life or death negligence.
Right. If a compliance officer feels they are being accused of manslaughter over a miscoded outpatient procedure, their defensive walls will immediately go up.
They'll write the author off as sensationalist and the opportunity for reform is lost.
Exactly.
But to the author's credit, the text does try to remove individual blame. They talk about systems engineering concepts like the no-blame huddle, where teams review anomalies without pointing fingers.
Yeah, they evaluate if the system failed, not the person.
Right. But we need to ensure its overarching metaphors don't accidentally re-inject a sense of catastrophic guilt. A billing coder isn't a negligent pilot. They're just overwhelmed by 70,000 shifting procedure codes.
So true. The suggestion to fix this is to calibrate the comparison by grounding the abstract financial statistics directly in their immediate human consequences.
Okay, so maintaining the objective tone while still justifying the high-stakes urgency of the aviation parallel.
Exactly. You have to clearly explain the underlying causality between a leaked dollar and a lost life without resorting to hyperbolic shock value.
So moving from a purely financial abstraction to a concrete reality. What is a concrete example of doing that in this manuscript?
Well, the author can leverage the specific data points already buried in the text to reframe the argument early on.
Like what?
Like highlighting that $80 billion in improper payments translates directly to the lost funding for 80 new regional hospitals, or thousands of nursing salaries.
Oh, right. Connecting the spreadsheet directly to the bedside.
Exactly. And as a second concrete example, reframe the fatal crash of healthcare. It shouldn't be framed as a sudden, dramatic explosion like a plane going down.
Right, because that's what makes it feel hyperbolic.
Right. Instead, explicitly frame it as the quiet, systemic denial of essential care to vulnerable populations due to depleted resources. The crash happens in slow motion.
That is a profound shift in perspective. A plane crash is loud. It makes the evening news. But the failure of a trillion-dollar healthcare system is entirely silent to the general public.
It really is.
It's a denied claim for a life-saving medication, or a rural clinic shutting its doors because state matching funds dried up.
Exactly. By explaining how the mechanism of administrative waste literally defunds regional care, you validate the urgency of the aviation analogy without making administrators feel like murderers.
You show them that the dam isn't just leaking water, it's leaking the lifeblood of the community.
Precisely. And doing that elevates the entire manuscript. It transitions from a purely financial critique into a deeply human imperative.
Which completely justifies that intense aviation parallel.
Right.
Well, to wrap up this critique, the material we reviewed today is incredibly robust, but it can be strengthened.
Definitely.
First, by explicitly addressing the political constraints of the aviation analogy early on, proving the proposed frameworks can survive the jurisdictional battles of Medicaid.
Yeah.
Second, by interweaving the actionable engineering frameworks, like the AI detection models and the Sentinel state pilots, earlier in the diagnostic chapters.
So the reader sees the cure alongside the disease.
Exactly. And finally, by grounding the massive financial statistics in concrete human costs, reframing the crash as a quiet depletion of resources to perfectly balance the tone.
It truly is a remarkable piece of analysis.
We highly encourage the listener to apply these structural and thematic adjustments and submit the revised work back to us for further feedback. Absolutely. Because when you're standing at the base of that massive dam, watching billions of dollars wash away, you don't need a historical lecture on the properties of water. You need the engineering blueprints to pour new concrete.